Hello, I'm Dr. Dennis McKenna. I'm so pleased today to be joined by Dr. Vic Becker. Vic, it's great to have you here.
Thanks, good to be here.
Again, you've been here a few times before. Vic is our System Chief Health Information Officer. Think about everything related to our EMR and many other things as well. We'll talk about that in a little bit. Today is Monday, July 21st, giving you an update from Albany Med. And it's been hot lately. Heat broke a little bit this weekend, which is nice, but obviously hope everybody's staying cool out there. A couple of items, really all positive stories we want to focus on. So last week we were visited by Hyundai, who was here, Hyundai Hope on Wheels. And this was an event which was really, we want to thank the Leah family and their generosity and local Hyundai dealers. This is to benefit the Melodies program at Albany Med. I don't know if you saw it, but They bring a car up and they let some of the children in the Melodies program do some finger paint and put it on the car. But we had some great speakers there talking about the important, impactful work that we do in the Melody Center.
Yeah, that's great. The kids enjoy it too.
They do, and it's a great awareness of the wonderful work of the team up there in the Melodies program. And once again, we want to thank the Leah family for their generosity. Some really exciting news that we've announced recently, and we can talk a little bit more about it here, which is this partnership between Albany Med and Maria College, and creating a joint program for the creation of radiology technicians. So this is really important work. We know that on every day here at Albany Med, there are people who order all sorts of imaging, x-rays, ultrasound, CAT scans, MRIs. It's integral to what we do. And the truth is we need more individuals out there trained in that. And this is a partnership that we have where we will create through some schooling, more individuals who will come out of that with the ability to be working in that field. Very important.
Yeah, these folks are really, they're the face of the department. They're the folks with whom the patients are interacting the most when they're having imaging studies done. And the degree of training and the technical understanding they need to know to perform these procedures safely and effectively is huge.
That's an important word, because we are talking about radiation in many cases, so doing it safely for the staff, for the patients. There's science behind this. This is a great career track. This is a great career track for individuals who are thinking about getting into the healthcare space. So the inaugural class will be seated this year. The class is going to grow. We're hopeful, of course, that many of these people, when they graduate from this program with Maria College, will stay and work inside Albany Med, inside the Albany Med Health System. With a couple of people we want to thank, John DePaula, one of our senior vice presidents here, who really spearheaded this, working with Dr. Lynn Ortel, who's the president over there at Maria College. So really, this is wonderful. And Vic, if we were to turn the camera, we're not going to be able to, but right over there on the other side of this wall is the training space. So we're already building out the place where students will, on campus, learn about the equipment and all of the science behind doing this. So looking forward to it. Congratulations to them. Really important.
Great program.
Did you get a chance to see the annual report that we put out this year?
Yes, that's a wonderful document, comprehensive.
Comprehensive, indispensable, right? That's the word we landed on, really to describe the incredible work that the Albany Med Health System does in all three parts of our mission: clinical care, education, research. There's also an insert there that talks about the economic impact of the health system, close to $6 billion regionally, as far as jobs and produce and economy stimulating work that the health system does. In addition to that, focusing on our community partnerships. And it really is an unbelievable, it's by far and away, I think, the absolute best annual report we've done. We've done something different this year. Not only are we sharing it with our workforce and with members of our board, but we're sharing it more broadly in the community. And we're sending it out to local elected officials and CEOs of other companies and leaders, civic leaders, because we want them to understand what's happening here inside the Albany Med Health System. And I believe it's also on the internet, and people can click on that and view that as well.
Yes.
Yeah. So there's a couple of people we want to thank who made that happen. And this is a partial list. You always get in trouble doing this, right? Melissa Mansfield, Therese Garcia, Lori Hansen, and Mary McQuaid. Among others, of course, as well as Matt Markham and the team really put together this very comprehensive report. One other thing I want to point out about this is when we do this, we actually partnered with the Center for Disability Services, and we partnered with the New York State Industries for the Disabled as far as getting this mailed out. So it's just another example of where we're deeply embedded in our communities and looking for partners where they can help us and we can help them at the same time. So if you haven't had a chance, please check that out. All right, Vic, did you go to the employee picnic last year?
Yes, I did.
Excellent.
Yeah.
Well,
great gathering.
It was. We had a couple of years where we couldn't do it because of COVID. And when we started it up again, I think it was received very enthusiastically. This is one of those events that everyone looks forward to. So we have, save the date, on let's call it the New Scotland campus here, Thursday, September 18th from 11 to 2. And then down at 1275 Broadway, Friday, September 19th from 11 to 2. Now, we have well over 100 offsite locations, right? So we know often it's challenging, right? But with enough heads notice, obviously we're going to try to make sure that everyone can participate in that. And as always, we'll be looking for some volunteers, people to help us out with that, and it's going to be fun. Maybe this year we should get like a dunk tank. What do you think?
If the heat persists, you'd be welcomed.
Do you want to volunteer to sit on
I would volunteer, yes.
Okay, mark that down. Employee picnic is going to be coming up in September. It's going to be a great day. Looking forward to that. You've heard of our Daisy Awards.
Yes, of course. Yeah.
Daisy Award is very special every month. There's a nurse who's recognized among a bunch of other nurses who've been nominated. The nominations are very special because their nominations come from patients that they've cared for or family members who've seen and observed that care. So this month we'd like to congratulate and celebrate Dan McCrae, who's a nurse on C2. C2 is a very special unit here, surgical floor, taking care of colorectal patients. A grateful patient recognized the work of Dan McCrae, described him as professional and compassionate, and it was a wonderful write-up. So do you know what they get on that floor? Do you know what they get? Cinnamon buns. They get the cinnamon buns. They get the cinnamon buns thanks to Dan, so congratulations. All right, now Vic, I've been talking a lot. Let's change the focus over to you. As our System Chief Health Information Officer, I generally characterize your work as all things related to Epic.
Yeah.
I think that's an oversimplification of really what is important, impactful, complex work. You are obviously, right there, driving Epic out across the health system, first at Albany, then on the other campuses. You're now doing it with the visiting nurses. We went through a period of stabilization. Now we're moving into optimization.
Right.
Take it from there.
Yeah, so it's been over a year now since we went live at Albany Med, about 9 months since we went live at the Wave 2 campuses of Saratoga, Glens Falls, and Columbia Memorial. That stabilization phase was key. Really, it's about fixing the things that were broken during the go live. Now, that was just establishing the table stakes of a top-tier electronic medical record.
Right.
Now we're working to really optimize. There are already many benefits that have been realized in terms of establishing a single electronic medical record, a single clinical and rev cycle system from what was a panoply of 13 of them, I believe.
Incredible.
So our providers, our users are already realizing many of these benefits. That said, there were many things that existed in the legacy systems that had many years to develop.
Right.
That took a lot of
that
investment.
people were used to.
That's right. Yeah. So now we're fielding requests from our end users to optimize the system, to improve Epic. This started right after the Wave 2 stabilization.
Right.
So it started in January. We're receiving about 90 requests per month, so about 1,400 requests have been processed so far. About 10% of those have been built. They've been completed and are built in the system, in the production system. We're getting, I would say, we have about 300 or so that are in various stages of evaluation.
Good.
There are a few that get rejected, and most of those are because either the functionality already exists, it's coming with a future upgrade, or it's simply not feasible.
So let's go back on that a second. I'm an end user. I'm in the electronic medical record. I'm a physician. I'm a nurse. I'm a rad tech. I'm like, geez, Dr. Becker, I'd love to see this in the electronic medical record. I'm used to seeing it. I don't see it now. In some cases, the answer is it's there, and let's show you where to find it. So that's great.
Yep, simply a training issue.
In some and in some cases, that's a great call out. Here's the good news. In a few months, we're going to take an upgrade, and it's going to come with that package.
Yes.
And then in some cases, we understand why you may want to do that, but that's not available, or at this point, we're going to focus on something of higher order magnitude.
Right.
And so there's reasons behind that. It's not just ignored.
Correct.
Yeah,
Right.
very good, very good.
Like I said, about 300 or so are in various stages of evaluation. Right. About 150 are already approved and pending build by the analyst team.
I had an opportunity recently to sit down with one of your Epic Analyst 3s, Mr. Dwayne Betford. I was talking to him, and I was really impressed by the amount of time that the people who build these reports, whether it be in Epic or some of the data that gets pulled out, there's a lot of training that goes in to really be, quite frankly, skilled enough to do that work. So when your team is building these modifications, it's because these are very smart, thoughtful people who really are working in a complex system,
yes,
and doing it in a way where hopefully it makes the care better, it may make the experience better, it may result in better quality scorecards. There's a lot of value in the work that they do.
Yeah, and it's very complicated, as you mentioned. The proverbial butterfly effect of not knowing always that a request that seems very simple could have many knock-on effects and require a very intentional build.
And it brings up another important point. Nobody likes downtimes, right? Nobody likes downtimes, but the downtimes, it seems to me now, are occurring in a way where they're very quick. We're down, we're up. It's happening on a regular basis, and there's real value to that because we can put in those new changes. Can you talk about that?
Sure.
And when we do that, we do that across the whole system, right?
So Epic releases new versions every 3 months.
Right.
We take upgrades every 6 months. So we take 2 version upgrades every 6 months.
Okay.
Very predictable, and it's really essential to us remaining current on the platform.
All right.
We want to make sure that we're always able to adopt and implement the newest functionality that Epic develops, and that really requires staying current on the most recent version.
This is a terrible analogy. This is like bringing your car in for an oil change, tire rotation. You have to do it every now and then, right? Keep it running.
Yeah.
So that's great. All right, last topic, MyChart. When we first rolled out Epic, we encouraged people to sign up for MyChart. I remember at the time we talked about we had 20,000 people on MyChart, 30,000 people. Those seemed like big numbers at the time. What are we up to now?
We're at about 270,000.
Wow.
So over 250,000 of our patients have signed up for MyChart.
And for those out there who've not signed up for MyChart yet, what would you say is the value and why they should do it?
I mean, it's easy access to all of your medical data. Include your medication list, the notes from the providers. All test results are immediately released to the MyChart patient portal. So it really enables patients to be informed and engaged in their own care.
And if you have a parent, for example, with their permission, you can get proxy access to the records, which is a wonderful way for people who may have an older parent and they're in the hospital to be keeping track of what's happening when they're here. Whether it be of your child or your parent, it's a fantastic thing. So you go to the App Store, you download Epic MyChart, easy.
And you just need an activation code from your care provider to get access.
Great. Anything else you want to chat about?
No.
All right.
That's it. Thanks.
Well, appreciate it. I don't know if you know this about Dr. Becker. He likes to ride his bike outside a lot, so stay cool out there.
Thank you.
Enjoy your time in the woods. And thank you to you and your team for everything you do. Thank you to all that you do as well here on this campus now more than ever. Obviously, summertime, very busy, but we're taking care of the mission, and we appreciate that very much. We'll see you in 2 weeks. Ask that you once again take care of yourself and take care of each other.